Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was the first part of the question from today. My mum has been in intensive care for 3 weeks now and she's on ECMO for ARDS. Will she survive? You can check out the first part to this question if you're clicking on the link below this video. Ellie, the reader who's asking the question, has also been featured in our podcast in an interview that you can check out again if you're clicking one of the links below this video. So in this week's episode of Your Questions Answered, I want to answer Ellie's next question as her mother continues to be in intensive care. Ellie writes, "Hi Patrick, thank you once again for your detailed reply. It's a great help to make me feel more in control and more empowered. As you know, my mother has a hole in each lung that are getting bigger. These are from the damaged lung tissue from the pneumonia and the ventilation. One of the holes is leaking pus on the side of the lung by the rib cage, so they have a drain which is taking the pus out. She's on the fentanyl for the pain this drain is causing, which is like pleural pain apparently. The antibiotics are working on the infection, although slowly, and there hasn't been any change last night. My mother is wide awake and not sleeping, and she had no sleep at night for the last 3 days. She's looking very distressed and she's screaming some of the time. The doctor said she will have serious delirium from the infection. Does that sound right to you? She's currently taking 30 micrograms of clonidine per hour and 50 micrograms of fentanyl per hour, which they are weaning slowly. Also, the lorazepam is 1 milligram per hour and she's getting quetiapine as well. Here's my question to you when you have a chance. The doctors are saying bugs can hide in the outside of the holes, so is it really possible to completely clear the Pseudomonas, or will she need lung surgery, which the doctors mentioned she may need at some point? The intensive care doctors also confidently said that my mother won't remember this section of the delirium as the infection is so bad. Is that true? She seems there even though she's not responding to commands. Do you think my mother can sense me being here? I'm getting to the point where I don't like taking a day off now, as I feel she needs me there. But I am very tired. How long might it take to get rid of this infection? The doctors wouldn't say, but they referred to 3 to 4 months later in the conversation. I'm concerned my mother is not getting rehab as the condition is really bad. They need to lie her flat at any point, so they can't sit her up on the edge of the bed. She can't lie on her sides, which is a shame, only a tilt. My mother used to be up every 20 minutes, so this must be a torture to her. She can't move anything but her neck. She's not getting enough rest and she's not getting enough activity, and this might go on for 3 more months. The doctor said she will have the delirium whilst she has the infection. I really feel that my mother's human rights are out of the window. She's not allowed to speak or scream, no sleep, no daylight, no movement, no activity other than the music I bring in and all their tests. No food, no drink, nothing. She really looks like she's suffering, and no one really knows what effect the drugs are having, that she can't speak of, like sicknesses, etc. The doctors are saying when she's suffering more, then she's getting better. Then we can have the discussion about withdrawal of treatment. The doctors currently believe she isn't suffering, as she won't remember anything anyway. Do you know of any cases where patients remembered it? I'm sure I have read of some. The doctor says if her body can't take it, then we will listen to it. But the damage done is because of the ventilator. Even though they got her in there saying they will rest her lungs with ECMO, the result is they have damaged her lungs with the ventilator, causing holes and an air leak. One of my main concerns is whether her brain can take all of this. Her sanity has always been my concern, and I dread to think what psychological effects all this will have, not to mention long-term effects of the holes in lungs and all the drugs, none of which has been discussed, as she says it's too early to tell. I really want her to have peace and quiet, and have put notices up about noise, causing stress, lack of healing, and adding to the delirium. She has earplugs, but they only muffle the sound, they don't block it. I went to PALS today to complain about the phone, which rings and rings and needs a volume control as it's too loud, and the nurses were gathered by her bed talking loudly about another patient. As I said to them, the only thing she's able to do is to hear. She can't move or speak, but all they do is just chat away. My mother needs sleep to heal, and she's not getting it. Is there anything else I can do? Also, the lights went out at 11:30 p.m. last night, and it's usually at 10 p.m. Can I ask for them to go out earlier? They take her earplugs out and lights on at 7 p.m, but she's critically ill. She needs as much sleep as she can get. It really frustrates me. I've seen your posts about home care, but I don't think that's an option here, is it? If you can answer these questions, that would be really appreciated. Many thanks, Ellie. Hi Ellie. I'm so sorry to hear that your mother is still going through such a terrible time, and I know you are going through a terrible time as well. And I also hear you clearly, and I can see that you are very stressed. And Ellie, that's perfectly fine. In such a difficult, frustrating and challenging situation, the only thing you are worried about is your mum. That's great and honorable, but you need to take a rest as well, and I will tell you why in a minute. First of all, Ellie, take a deep breath and give yourself a pat on your back for coming so far and for being so strong. Next, take a look at the blog post here, which is, does my critically ill loved one in an induced coma or with head injuries feel my presence? That's the first blog post you should have a look at. That answers one of your questions. The other blog post I would recommend, and I put a link in below the video as well, is be more selfish if your loved one is critically ill in intensive care. This blog post in particular will give you more perspective why it's so important that you need to look after yourself. I believe, especially with your 8-month-old baby, you are currently going through hell, and I'm worried that you might get sick and even more tired. Especially because you are saying that you are tired and you don't want to leave your mother. I can totally relate to that, Ellie, and I think it's now you and your baby who needs to come first. Your mother will need you one way or another, but you need to stay strong and keep your sanity above all, and the only way to do that is by having a rest and some time out. It's a big issue that families of critically ill patients feel guilty, and they suffer just as much as their loved one by seeing them suffering. Ellie, here is what you need to know. First, your mother is in a very difficult situation and she's very sick. There is no question about it. Second, the doctor is correct to say that it's still too early to look at a withdrawal of treatment. Whilst I know how awful it is for you to watch your mother in this condition, your mother is too young to give up. 58 is not old. Your mother could live for another 30 years. Third, if your mother does recover, she will have a long road to recovery, and don't underestimate how resilient people can be. I have seen this over and over again in intensive care, and it's been one of my biggest life lessons that people can be extremely resilient against all odds. For some perspective, you wouldn't be here today if your ancestors hadn't been resilient. Your ancestors lived over millions of generations through war, famine, and other catastrophes during times when there were no hospitals, no intensive care, or any of the other luxuries we have today. Put it in perspective and know that you and your family are resilient. It's no guarantee, of course. However, it's very important that we all know where we came from. Fourth, the holes in the lungs. you are referring to, which are pneumothoraxes, are a concern for me, and it worries me that after many weeks of having chest drains, those pneumothoraxes have not resolved. I know the doctor hinted at surgery, but again, just like with a lung transplant, your mother needs to be infection-free. She also needs to be infection-free for surgery. It sounds like the infection is getting better and the drains are high infection risk in and of itself. Fifth, the doctor also mentioned that your mother is delirious because of the infection. I question that, and while the infection may be part of it, I would think it's a combination of a drug-induced delirium rather than an infection-induced delirium. Withdrawal from drugs is certainly a part of it after many weeks in an induced coma. Otherwise she wouldn't be on clonidine 30 micrograms an hour, which is a fair amount and can be effective for coming out of an induced coma. Sixth, fentanyl 50 micrograms per hour is a fair amount as well. However, with the chest drain still in place, your mother will have some pain, and as you've told me, they are taking your mother off the fentanyl, at least for a while, and that's good. Seventh, I guess your mother still needs the lorazepam and the quetiapine. Quetiapine is an antidepressant for the delirium and also to deal with potential withdrawal from midazolam or temazepam. Eighth, can your mother hear you in the situation she's in? As I said before, have a look at this blog post, it'll give you the answer. Does my critically ill loved one in an induced coma or with head injuries feel my presence? Check it out in the link below this video. Most critically ill patients don't remember their stay in intensive care. They usually only remember waking up once they were on the ward. I know how terrible you feel, Ellie, when watching your mother suffer. And that's even more terrible because you know there's no guarantee about the outcome. Ninth, I know you feel like your mother has no human rights. However, this is an exceptional and difficult situation, and exceptional and difficult situations require different responses, and I really think your next step is to remove yourself at least for a couple of days. Number 10. I know you are worried about lights off and peace and quiet at night. You need to know that critically ill patients have no or little awareness of a day and night rhythm. Yes, sleep is important and sleep can heal people. There is no question about it. The situation your mother is in, however, demands that the nursing staff give her the same care and attention day or night. They still need to turn your mother regularly to prevent pressure sores, and they still need to do regular mouth care, eye care, washes, etc. to prevent any infections there and to keep everything nice and clean. Therefore, keeping everything at a minimum at night is probably what they are already trying to do. However, it can be difficult. Intensive care is a 24/7 environment. Number 11. I don't think that the earplugs you are referring to will be the answer, as you can be pretty certain that your mother won't remember anything. Your mother has far bigger issues to deal with, and whilst the devil can be in the detail, I don't think that earplugs will make or break your mother's situation. And regarding your question about intensive home care, it's not an option in the UK, only in Australia. Check out intensivecareathome.com.au for more information. Ellie, this is really about you and your sanity. I know how terrible it must be watching your mother in this situation, and you need to zoom out for a while to keep your sanity. A friend of mine was in ICU 2 years ago with Legionnaire's pneumonia. He's in his late 50s, a heavy smoker, and we all thought he was going to die. Given the knowledge that I have, I had little hope for him, and he miraculously pulled through, and he's so happy to be here. He doesn't remember anything, and he now enjoys a good quality of life. Whilst there are no guarantees for your mother, at this stage there is not much you can do for your mother besides what you are already doing. What you can, and what I even urge you to do, is to take some time out and do something nice for you. It's summer in the UK. I'm sure you have plenty of things to do. Take your mind off things for a couple of days. It'll do wonders for you. You need to be strong for whichever way this situation will go. Once you've gotten some rest, and once you've gotten your strength back, then it's time for you to look at your next steps. The next steps for you, and only after you've had a rest, facing this challenge, is to get more composure. Maybe you are doing it already, but in any case, take a look at this blog post here. Why your body language may be your biggest obstacle to peace of mind, control, power and influence whilst your loved one is critically ill in intensive care. There's a link to this blog post below this video. I really hope this helps, Ellie. Take a step back for a couple of days, stay positive above all, and keep up the good work. Let me know if you get stuck and we can have another chat on Skype. Thanks again. How can you have peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you'll learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care. And how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you in another update next week.